Good evening to all, and today we're going to discuss about the abnormal waves of ECG. Okay, so before going to the topic, we should know what is ECG and what is the physiology between the ECG, how the ECG waveform is formed. So, what is the physiology behind the ECG? Then, what about the normal ECG patterns? So, what is the normal PR interval? What are the normal RR interval and QRS complex? So, like that, we have to know about the what are the normal ranges. Then we should go for the abnormal wave patterns of the ECGs. That is for abnormal different kind of disorders. Okay, so first we'll discuss about the ECG. What is meant by ECG? So ECG is called as a electrocardiograph or electrocardiogram. So electrocardiograph is the equipment which is used to record the ECG, electrocardiogram. So a electrocardiogram is defined as that it records the electrical activity of the heart. So the electrical activity of the any muscle is called as the electrocardiogram. If the electrical activity of the brain was recorded, it is called as electroencephalogram. If the muscular activity is recorded, the electrical activity of the muscles is being recorded, this is called as EMG. So like this, the electrical activity of any other muscle or tissues or whatever the body organ is tell about the physiology of the particular organ. So the EEG tells about the physiology of the brain. The EMG tells about the physiology and the working condition of the muscles. So like that, the ECG tells about the normal working of the human heart. So the physiological function behind the human heart. So that will be addressed by the ECG. So the significance of recording of ECG is about to diagnose any kind of disorder related to the heart. So we know the normal disorders like heart attack. We commonly call it as a heart attack, that is myocardial infarction, and the stroke and the heart block, cholesterol due to atherosclerosis. So these are some common disorders of heart. So these kind of heart disorders can be diagnosed with the help of the ECG. So this is the very basic diagnostic step to diagnose the disorders related to the heart. Then after the ECG only the physicians can go for any kind of ultrasound imaging, CT imaging and MRI or PET, SPECT like any kind of imaging. So thermodilution methods to find out the stroke volume. So these kind of methods are the secondary methods. So the very basic preliminary diagnostic technique which is used to identify the disorder of the heart is ECG. Right. So first we should know about the features or characteristics of the ECG. So this is the normal heartbeat. So this is PQRST waveform. This represents one complete cycle. So it begins with the P wave and ends with the T waveform. So this is called as one complete cycle, one complete electrical activity of the heart muscle contraction. That is one lub and one dub. So the contraction and relaxation of the heart muscle. So this is one complete heart cycle or cardiac cycle. So this number of cardiac cycle is called as heart rhythm, that is heart rate, pulse rate. So the one complete cardiac cycle represents about the PQRST waveform. Okay. What is the physiology behind this PQRST waveform? How the P wave forms and what represents the QRS complex and which activity of the heart represents ST. So that is normally what is the electrical activity of the heart? So to pump the blood, the contraction and relaxation is necessary, right? Then for the contraction and relaxation, one impulse is necessary, right? So the from the SA node, the electrical impulse is generated. Okay, then the electrical impulse is passed towards the heart muscular organ. So whenever the heart electrical signal is allowed to pass through the regions of the heart, it gets contracted and it gets relaxed. So this is the physiology behind the heart muscles. So the SA node is called as a pacemaker. So in the SA node, the impulse is generated. If any failure in SA node, there is a no possibilities of electrical activity of the heart, because without the generation of impulse, the electrical activity is not at all possible. So for those who has a failure of the SA node, they are placing the artificial pacemaker. So with the help of artificial pacemaker, they can generate an electrical impulse so that the contraction and relaxation takes place. So this is the normal electrical activity. And now this is the P wave, and this is QRS, and this is the T wave, right? So the P wave is the electrical activity that causes the atrium to contract, and this is the QRS complex. So the QRS complex represents what? The QRS complex represents the electrical activity, and it causes the ventricles to contract. Okay, so first initially the electrical impulse is generated at the SA node. So this is the SA node. So once the electrical impulse is generated, it gets transmitted towards the atrium. So this is called as atrial depolarization. So the passage of the electrical impulses causes atrial depolarization. So the atrium gets contracted. Okay, then again it passes to the ventricles. After the atrial depolarization, atrial repolarization takes place. So the reversal of minus and positive and negative ions is called as depolarization, and again going back to the original position is called as repolarization. So this depolarization and repolarization is producing a waveform called PQRST. So P wave is the atrial depolarization. So whenever the atrium gets contracted, the P wave is generated. If any problem occurs in this atrial contraction, there is a deviation in the amplitude and the time duration of the P wave. So with the help of this P wave, time duration and the amplitude deviation, we can able to diagnose the disorder which is related to the atrium contraction. So after the atrium contraction, the QRS complex. So the QRS complex is the major role in the ECG characteristic. So this causes the ventricles to contract. That is the ventricular depolarization. Right. So ventricular depolarization causes the contraction of the ventricular muscles. Okay. Then the T wave represents the again the resting state. That is repolarization. Ventricular repolarization is called as T wave. Then once a small waveform, usually it is called as U wave, that recovery. But the U wave is not a mentionable parameter in the ECG waveforms. So they are simply ignoring the U. So the PQRST is considered as the features of the ECG waveforms and characteristics of the ECG waveforms. Okay, so the any atrial related disorder was identified by the P wave, and any ventricular related problems such as ventricular fibrillation and some other ventricular bundle block, that can be identified with the help of QRS complex, and the ST elevation, ST segment deviation may represents the myocardial infarction or any other disorders. So with the help of the deviation of any of the characteristics, we can able to diagnose the any kind of heart related disorders. So we going to discuss about the different types of abnormal ECG waveforms related to the each category. So first we'll discuss about the general categories of the abnormal waveforms. Then we'll focus on to the each category, that is the abnormality related to P wave, the abnormality related to QRS wave, the abnormality related to ST wave, like that. Okay. So the heart rate also can be calculated with the help of this ECG waveform. The RR interval, one cycle between the other cycle. So that RR interval represents the heart rate. So the RR interval divided by 16, the time period of the RR interval divided by 60 yields the heart rate. So this kind of heart rate calculation is more accurate than the any other kind of pulse rate and heart rate measurement system, right? So PR interval and QT interval. As I said earlier, the time period, the amplitude and the interval. So if any the interval gets increases or the interval gets decreases, obviously there is a problem in the physiological activity of the heart. So there might be a problem in the maybe the atrial contraction may took so long time. Same way the ventricular depolarization may took very long time, or within a short duration of time the ventricles get contracted. What happened? So the sufficient amount of blood is not pumped out if the duration is very less. So that may lead to any kind of heart disorders, right? So the interval states the any kind of abnormalities. So the PR interval usually it takes the atrium to the ventricles. So the time taken or the amount of blood which travels from the atrium to the ventricles, that is called as PR interval. The QT interval explains about the ventricles to contract and relax. So should be within the normal limits. So both the values should be within the normal limits. Okay, so this is the general physiology of the heart. So far we have discussed about the significance of ECG and the electrical activity of the heart and the normal ECG characteristics, that is PQRST, and how what represents P wave, what represents QRS complex, and what represents T. So far we have discussed about the normal. So hope the electrical activity and the physiology is clear. Okay. So now we move on to the abnormal heart rate, that is abnormal ECGs. What are the different abnormal patterns of ECG? What are the different kinds of disorders present in the heart? Okay, so the abnormal heart rate, irregular rhythm, abnormal intervals, tachycardia, a greater heart rhythm, lesser heart rhythm. So these are some categories of the abnormal ECGs. So the abnormal heart rate means what? The deviation in the heart rate, that is tachycardia and bradycardia. So if the heart rate is lower or if the heart rate is faster, so that is called as abnormal heart rhythm. Irregular rhythm, which represents about the interval between the PQRST. So that is irregular. There is no synchronous rhythm between the PQRST waveform. That is called as irregular rhythm. Abnormal interval. So we already discussed about the PR interval and QT interval, right? So the abnormal interval means PR interval deviation, QT interval deviation. So that is called as abnormal intervals, right? Then fast heartbeat, slow heartbeat. So this is, that is the 72 beats per minute is a normal range. So if it exceeds more than 100, that is called as fast heartbeat. So tachycardia, bradycardia. If it is below than 60, if it is below than 40, so that is irregular heartbeat. So this shows like this. So faster heartbeat and slower heartbeat. So it increases the cardiac cycle. So it decreases the cardiac cycle. So this is called as irregular heartbeat. Abnormal heart rhythm and abnormal waveform and abnormal intervals. So the abnormal heart rhythm is the irregular heart rhythm. That is a long pass or an extra pass like this. So this is abnormal heart rhythm. So the pass between a PQRST, so that is abnormal here, abnormal over here. That is called as abnormal heart rhythm. Abnormal waveform, that is the not being transmitted or conducted properly. So that represents the abnormal waveform. If any deviation in the conducting system of the heart, so the conduction of Purkinje fibers or the conduction from the atrium to the ventricle, so any kind of conducting system related disorder is represented by the abnormal waveform of ECGs. Then abnormal intervals, so the time duration between the each interval. A prolonged PR interval can indicate a problem with the electrical conduction system of the heart. So the prolonged QT interval is also related to the left chambers of the heart. So these are some examples of the abnormal heart rhythm. And so this one is the normal sinus rhythm. So this is normal ECG. So see here, so a P waveform, QRS waveform and T elevation. So PQRST, one complete cardiac cycle. So this is the normal. Here it represents the amplitude range and the time duration between one complete cycle. So this is normal sinus rhythm, right? And this one is a ventricular fibrillation. What does mean by fibrillation effect? So before going to the ventricular fibrillation, first we should know about fibrillation. So fibrillation means the asynchronous heart rhythm. So see here, it doesn't look like a PQRS waveform. So it looks like a random sinusoidal wave. So which means asynchronous heart rhythm. So not at all a proper electrical conductivity of the heart. So the not irregular, asynchronous heart rhythm. So it is this type of condition is called as fibrillation. So if that asynchronous heart rhythm is due to the ventricular contraction or it occurs in the ventricles, then it is called as ventricular fibrillation. So if the asynchronous heart rhythm is due to the atrial contraction or it occurs in the atrium, then it is called as atrial fibrillation. So these are two kinds of fibrillation, but mostly the more common fibrillation effect is a ventricular fibrillation effect. So this is one common disorder related to the heart. Then this one is a block, atrioventricular block. So block, certain reasons for block due to the cholesterol, due to the fat deposits or due to any kind of blocks. So that will lead to the reduction of blood flow across the atrium and the ventricle. So this also stops the blood flow to the peripheral organs also. So then what happens if the blood supply reduces, the oxygen supply reduces, it affects the metabolism and ultimately finally it leads to death also. So this is atrioventricular block. Okay, any kind of block. Here the QRS is absent. So here in this cycle the QRS complex is absent. Then here QRS is present. Again after a cycle the QRS is absent. So this may be due to the block. So because of the presence of fat deposit block, the contraction and relaxation is not proper. The blood flow between the atrium and ventricular is not proper. So that's why the ECG looks like this. Okay. Then the atrial flutter. Atrial flutter. That is the atrial contraction disturbances. So because of that, here it looks like a noise or flutter like waveforms. So this represents about the atrial flutter. So this is atrial fibrillation. So here this is a ventricular fibrillation and this is atrial fibrillation. So I already explained about the atrial fibrillation. What is fibrillation? If it occurs in the atrium, it is atrial. If it occurs in the ventricular, it is ventricular. Right? So this is atrial fibrillation. So these are some common abnormal ECG waveforms. So AV block. So already discussed due to any reason of block, first stage or second stage or third stage of AV blocks with increasing severity. There is a possibility. So if we didn't diagnose at the earlier stage, the fat deposits get developed. So the block becomes very high. So immediately it can lead to stroke or even death also. So it stops the entire blood supply. So that is called as AV block. Yes, ventricular fibrillation. So as I said earlier, it is a life-threatening heart rhythm because with if we didn't proper treat with the ventricular fibrillation, there is a possibilities of a immediate sudden death due to this ventricular fibrillation. Suddenly it can lead to the cardiac arrest. So without immediate treatment. So if we identified any early signs of fibrillation, we should go for the treatment. So what is a therapeutic equipment which is used to treat this fibrillation, ventricular fibrillation? Yes, that is defibrillator. So defibrillator is a therapeutic equipment which is used to treat this kind of fibrillations. So the asynchronous heart rhythm can be synchronously tuned with the help of the external shock applied to the heart muscles. So in most of the films we may saw that defibrillator machines. So while the pacing the defibrillator in the heart, suddenly the heart rhythm gets increases. Suddenly it becomes the normal. So that is called as defibrillator. So this is a more life-threatening abnormal ECG waveform when compared to the AV block. So severely it may lead to the cardiac arrest. So we should monitor this and we should go for the early treatment. And premature ventricular contractions. So it is also known as premature ventricular complexes. So how this occurs means the ectopic beats can cause a fluttering or skipped beat sensation in the chest. So this is called as premature ventricular contractions. Atrial flutter. So flutter is a heart rhythm disorder, that means arrhythmia. So less heart rate, irregular heart rhythm, that is called as arrhythmia. So if it occurs in the upper chambers, it is called as atrial flutter. If it occurs in the lower chambers, it is called as a ventricular flutter. So but the most commonly occurring disorder is atrial flutter. Okay, so it can cause palpitations and it a shortness of breath and sometimes the giddiness and fatigue. It suddenly increases the heart rate. So these are the some symptoms of the atrial flutter. So it also may leads to the serious complications like ventricular fibrillation. So it also cause the heart failure and stroke. If we didn't diagnose at the proper time, the early diagnosis may reduce the mortality rate for the humans. So this is atrial flutter. Again the fibrillation, atrial fibrillation, we already discussed what is fibrillation. So if the asynchronous heart rhythm occurs at the upper chambers of the heart, then it is called as atrial fibrillation, right? The irregular rhythm can cause various symptoms and it may increase the heart failure and it may increase the effect of stroke and other heart related complications. Okay, and now we are going to discuss about the specific disorders related to the each category. That is for P wave category, the missing P wave. So the missing of P wave is called as atrial fibrillation. So if we miss the P wave or any kind of contraction improper, that may leads to the fibrillation effect. Then the abnormal PR interval, the prolonged PR interval and the shortened PR interval is also the commonly available abnormal ECG waveforms. So the prolonged PR interval, it may suggest the first degree of the heart block. So if we diagnosed at the prior stage, at the preset of stage, we can able to treat it properly. Okay, and the shortened PR interval. So the shortened PR interval represents about a disease called Wolff-Parkinson-White syndrome. So this is an Wolff-Parkinson-White syndrome is a heart related disorder. So if we treated at the early stage, we can save the patient and we can able to reduce the mortality rate of the person. Then abnormal QRS complex. So we discussed about the PR interval, right? Then the abnormal QRS complex. So the abnormal QRS complex means wider QRS complex and narrower QRS complex. So if the wider QRS complex usually indicates about the delayed ventricular conduction, that is the electrical conductivity between the atrium to the ventricular is very delayed one. So it is commonly mostly seen in the bundle branch blocks. So this is called as wide QRS complex. Then the tall QRS complex. So the tall QRS complex may indicate left or right ventricular hypertrophy. So it means it enlarges the heart muscles. So due to the enlargement of the heart muscle, it indicates the right ventricular hypertrophy. So this may widens the QRS complex. Okay. Abnormal Q waves. Abnormal Q waves may be the signs of the myocardial infarction. So next, the final segment is the ST segment abnormalities. So the particular ST segment, so already I discussed about the ST elevation. So the common cause is that ST elevation. So if any elevation in the ST segment present in that case means there is a high possibilities of the myocardial infarction, that is acute myocardial infarction. We can commonly call it as a heart attack. So that is, if any shoulder pain occurs, immediately we need to go and check about the ECGs, and if any ECG ST segment elevation seen in an ECG, immediately we should go to the physician and we should take care of the first aid, so that we can able to avoid the serious myocardial infarction. Okay, we can able to avoid the consequences of the heart attack or the acute myocardial infarction. So same way like ST elevation, ST depression is also one kind of abnormalities. So this ST depression explains about the myocardial ischemia. Okay, what does mean by ischemia? So the sufficient amount of oxygen is not supplied to the heart muscles. That is called as myocardial ischemia. So this shows the ST depression. So the ST segments gets decreases, depression. So in the ST segment there are two possibilities of abnormality. One is myocardial infarction and the other one is the myocardial ischemia. So the insufficient supply of oxygen and the heart attack. So this is related to the ST segment and the abnormal T wave alone. So if any inverted T wave or if any tall or peaked T wave occurs, so this is due to the previous any kind of heart damages or due to the ischemias. So the possibilities of the T wave taller and the shorter T wave. This also represents about the abnormalities in the ECG waveforms. Okay. Then the last abnormal QT interval. So the QT interval also the same like a PR interval, prolonged PR and shortened PR. So same way here also the prolonged QT interval, the shortened QT interval. So the prolonged QT interval is more dangerous and it may lead to the severe arrhythmias also. Then the shortened QR interval is less common and it is very rare, and this is mostly due to the calcium level deposits. So any kind of calcium deposits, and this leads to the shortened QR interval. So these are some disorders which is very specifically related to the each segments of the ECG waveform. So they are particularly related to the P wave and particularly related to the PR interval. So PR interval prolonged, PR interval shortened. So Wolff-Parkinson syndrome. So PR interval prolonged means acute myocardial infarction. Then QRS complex. Then the ST segment alone. So the ST segment elevation, the ST segment depression. So the ST segment alone is also responsible for to represent or to denote the disorder related to the heart muscle, that is myocardial infarction or any other kind of disorder, right? So the any changes in these any features of the ECG represents the or is very helpful to diagnose the disorders related to the heart system. So ECG is a very preliminary diagnostic method which is considered to diagnose the disorders related to the heart. So any kind of heart disorders can be diagnosed and identified with the help of ECG. Then further we have doubt, then we can go for the other echocardiograph or ultrasound imaging or the any kind of any other CT imaging modality, PET and SPECT. For example, if we have doubt in the cardiac output, that is stroke volume, means we can go for the thermodilution method, which is very helpful to identify the stroke volume, that is the cardiac output, how much amount of blood is supplied to the all parts of the peripheral organs. In the same way, how much amount of blood is pumped from atrium to the ventricle. So like this, if we need to analyze in more depth, means we can go for the some other techniques also, PET and SPECT, angiogram and angioplast. So these are some therapeutic method also available. So we going to inject some dye and we going to inject the catheter to visualize the distribution among the blood vessels. So if we need to study about the blood vessels in the heart rhythm and the heart muscles, mean we can go for this kind of techniques. So these are the some other diagnostic tools which are available to diagnose the heart related disorders. But anyway, ECG is a very preliminary method and very friendly manner, and we can easily acquire the ECG signal within a very short duration of time. So most of the basic preliminary method is a ECG. If any patient with some basic symptoms or a basic chest pain, the first and foremost step we can take as a ECG method. So with the help of this abnormal ECG waveforms and normal ECG waveforms, we can able to diagnose a number of disorders. I hope you are all clear with the different disorders related to the abnormal ECG waveform. So with the particular range of the QT interval and the time duration also, we can able to diagnose the different kinds of disorders. So but before analyzing the abnormal waveform, we should clear about the physiology of the heart. So how the blood flow takes place, from where to where and where to where the blood flow takes place. And the coronary circulation, what is meant by coronary circulation, what is meant by peripheral circulation. So first we should clear in these two. So we already discussed about in anatomy and physiology. Then the conducting system of the heart. So we should have clear idea about the conducting system of the heart, where the impulse is generated and how it conducted towards the from atrium to the ventricle. So if we are all clear in these two, then we can easily identify the abnormal ECG waveforms. What is the deviation over there and what is the abnormality over there. So these can be easily identified. Right? Thank you.